Yes. Let me pull up the PowerPoint really quick because it's not, where is it? Oh, I'm gonna have to open it. Hang on, Jill.
Okay. We have people starting to hop on. We are getting ready to go. Thank you everyone for your patience.
And now you're gonna have to help me technically with the slide view part. View.
Yeah.
Normal presenter view. Whoa, too much. Yeah, we may have to just like, you may have to help me once I share my screen.
Okay. If you need, I can share mine as well.
Can you see that?
Yeah.
Okay, now I just have to figure out how to present it.
Yeah. So there's a couple ways. If you want to go to, oh, you're a Mac. Oh, I don't know.
Yeah, well, I've got the view, reading view, slide view, outline view, presenter view takes up my whole screen, which is not helpful. Maybe slideshow, but no, then I don't have my note. I just need my notes.
Do you have two screens? If you don't have two screens, you won't be able to have it and have your notes sometimes, I feel like.
Can you see that? Oh, you see the whole thing, don't you?
Yeah.
Yeah. Nope.
And hello, everyone that's joined. Just give us one more second. I was not able to hop on early with Polly to help her out. We are wrapping up the plenary, so we appreciate your patience.
You know what, Jill, let me stop sharing and then you can just flip.
Absolutely.
You know how to do this. Sorry, everybody, my technical acumen is less than stellar. Stop share. And I sent you the deck.
Yep, I have it right now pulled up. Sorry,
everybody. Hi.
And so welcome, everyone. I wanted to introduce Polly McKinney, who is the Advocacy Director at Voices for Georgia's Children. If you are not familiar with them, Google Voices for Georgia's Children right now and sign up for their mailing list. That is how the biggest way I keep up with a lot of what's going on, not only during legislative session, but all throughout the entire year to keep you guys up to date, especially on children and families and policies that are impacting them. We've had so much happen since the pandemic in regards to supports for families and things going on. We want to make sure that you guys as service providers understand what's available and how to kind of tap into those things when you're helping families navigate these different systems and complexities that are going on. So I'm going to hand it over to Polly and let me know, and I will progress the slides.
Good morning, everybody. I am just stunned at how many people there are already, even in the chat. So welcome. I'm, as Jill said, Polly McKinney. I'm the Advocacy Director at Voices for Georgia's Children. And we are, just so you know, a whole child policy shop. So we look at policies and do research and stuff around pretty much every aspect of a kid's life. We do early care and learning. Oh, we do research. We do early care and learning. We do juvenile justice. We do child welfare work. We do after school and out of school time. We do child health, child mental health. We have like run the gamut on things that we work on. So when Jill asked us to do this presentation, what I tried to do, just so you know, is make it consumer based. And Jill, if you want to go to the next slide, as opposed to going deep into policy and how, in the next slide, and how policy works, what I really tried to do is to make it accessible for your guys' audiences. And so we looked at food access, housing, health, mental health, and the child care and child enrichment, like after school and things like that, and child tax credits. And it's a lot of information. So the deck, I don't even want to tell you how long the deck is because it is long, but all the information is in there. So after this presentation, you will have access to this deck. So you'll have the websites, you'll have what the programs are, some of the eligibility stuff, and what's available for your populations. So I hope that it's helpful, and I hope I don't put you to sleep in the process because it's like so much information. But I thought if I were a parent or a caregiver, this is the stuff I would want. I thought really hard about what information I would need, because as we all know, COVID is still a thing. And when COVID's not a thing, poverty is a thing. And when poverty's not a thing, dysfunction is a thing. And so we have all of these needs that our kids and families often are trying to absorb, and they themselves do not have time to do the research to find the website, or do the research to figure out how to pay their rent, or do the research to do all this stuff. So what I try to do is really think hard about one-touch options for you guys to share with your folks. And Jill is, I don't have the chat open because I get distracted by it. I'm like a dog with a squirrel in the chat. So I'm going to let Jill just grab questions as they come up.
Yeah, if you want to put any specific questions in the Q&A section and just general comments in the chat to help me kind of filter it out. Thank you guys.
So let's go ahead and get started. I tried to do them in sequence. Well, there was not really a sequence because when people are in need, they're really in need. So let's just start with food because everybody gets hungry and people need to eat every day. And what I have here is about 5 programs that some of them are COVID related and some are not. I'm sure many of you are already familiar with SNAP, which used to be called food stamps. And that is, put out by DFACS. And that is the sort of the underlying, one of the underlying feeding programs in our state that helps families in need purchase healthy food. And it's usually done with an electronic benefits card. You have to apply. And there are a lot of places to apply, but primarily DFACS or the public health office or food bank. And you can apply online at the gateway. That at the top, you'll see the gateway.ga.gov. Let's go on to the next slide, please. The eligibility is basically this, and it is income eligible. So we can go way into detail, but I would recommend just going to the SNAP site. I could talk an hour, just so you guys know. I could probably talk an hour on any given one of these programs. But I'm not going to do that. So we're just going to have like the whirlwind tour, like around the world in 80 days, except we're going to go around the world in 50 minutes. All right, let's go to the next program. The pandemic electronic benefits transfer. So COVID brought a lot of stuff. It made food access more flexible, and the federal government and the state worked really hard to figure out ways to get access to food out. And the pandemic electronic benefits transfer, the PEBT, as we like to call it, is one of those ways. So, and that is based on basically for kids who can't go to school, who miss school lunch, free and reduced school lunches and breakfasts. And so it was a benefit that they figured out to give, and we gave it last year, and now they're doing the research to see how to get it out to kids again. It is forthcoming. And we fixed a lot of hiccups that supposedly they're fixing a lot of the hiccups that happened when they first rolled out PEBT. But that's something to keep an eye out for, and to tell your folks that if they have an electronic benefits card already from SNAP, to hang on to it, because the last time they did, they loaded the benefits onto that card. And if you don't have a card, you'll get one in the mail once they figure out where you are and how to do that. So it's a PEBT is in addition to SNAP. Yeah, it will be. So, but check out, you can just Google PEBT, but I would wait maybe a week or 2 to see how they're going to roll it out this time. But it was very helpful to a lot of people. And now it's also, let's go ahead and click to the next slide. Initially, the first time they did it, it was for school age kids, and now they're doing children under 6. So it's a very, it's expanding, but finding out where all those kids are is quite an event for our systems, because some of our systems don't talk to each other. So just sit tight, and while DFACS works out how to talk to DOE and DECAL and all this stuff and find all those kids. Then we've got WIC, Women, Infants, and Children. It's supplemental nutrition, which has been around for a long time. It is significantly underused. So what I would advocate for you guys to do, it's a program for women, infant, and children's, as the name implies. And it has a number of things, including food benefits and healthcare and nutrition education. So if you have the ability to push that out, let's go ahead and click onto the next slide. It would be really helpful to advertise that to folks who are eligible, because the state is woefully underused in Georgia, and it could be so much better. And there are the eligibility things. Again, I'm not going to read every single word. Food banks. We all know about food banks. I think they all work a little bit differently. But if you want to find the big key for this one is if you want to find the food bank, the Georgia Food Bank Association has a really good find your food bank box on the homepage, and that's super helpful. But the food banks have been sort of the some of the like caulk between the bricks, connecting and supporting all kinds of everybody, really everyone.
We have a question really quick about this.
Yeah.
So they're asking, are they going to raise the income ceiling considering the rise in costs for just the basic food needs?
I have not heard of anybody doing that yet, but that's a really good question. And I know that the rise in the cost of commodities has been a thing in the news, but I have not heard anyone talk about raising the income ceiling rather. But that's a good question. Thank you for that policy question. I will ask our staff.
And we have another clarification question, which is, what do you mean by the systems don't talk to each other? Is that literal or just that they have actual databases that don't cross over?
Both, but mostly the databases. They try to talk to each other, but when you get the Department of Education is a massive entity that is trying to manage trying to manage all of the 181 school systems. And they have their, the longitudinal data system that keeps track of all the students. And I think it starts at 4 years old. I think they start tracking in pre-K, every kid gets a number, I think, once they enter pre-K or kindergarten. And then you have the Department of Early Care and Learning, which tracks Georgia pre-K, but doesn't necessarily track younger children. And then you've got DFACS, which is actually in charge of the electronic benefits cards and hasn't ever had to really talk to these. They have their own system and they haven't really had to talk to folks. And so it's been a technological challenge. And the first time they rolled it out, of course, speed is always of the essence, like time is of the essence with the pandemic and with feeding people. And so it's been quite a conundrum for them. And they've worked, to their credit, all those systems have worked very hard to figure it out and to find proxies and ways to find children. So yes, it's kind of both and. I mean, I hate to say unprecedented because it's in every other sentence these days, but it was unprecedented. And so that's where you find out where things don't talk to each other usually. So I hope that answers your question. Housing. All right. So housing is a myriad of things. And so what I did in this little section was the main place for housing supports to look is the Georgia Department of Community Affairs. There are lots of different ways. There are many ways to live. There are lots of different supports out there. And that also has been underused during the pandemic. And there's a lot of money floating around for housing. And we have had the expiration of the eviction moratorium, the CDC eviction moratorium. And that only covered federally funded housing. It didn't cover like non-federally funded properties. So there are a lot of folks needing rental support and even people needing mortgage support. And so what I did is I just put in a lot of homelessness going on. So I put in a bunch of resources at DCA, a bunch of links on the following slides so that you can go back, but I would recommend just going to the DCA homepage that I had on that last slide and checking that and seeing what fits your population. But so for instance, we have the Dream Home Ownership Program is financing for eligible home buyers. That exists normally, but then with COVID, they came up with a Georgia Mortgage Assistance Program. So again, it's for federal homeowner assistance fund to help with delinquencies and defaults and foreclosures. That's all COVID related. Let's go to the next slide. This is quite a lot of information, this part. So the Housing Choice Voucher Program is Section 8. We all probably heard of Section 8, but there's a application program there for that. I do think Section 8 is maxed out. I'll have to look at my notes. Give me just one brief second. But some of these things get maxed out, but the rental assistance program, the Georgia Rental Assistance Program is another COVID program that's supposed to help folks with rent. Some of this you have to keep checking back. If it says the program is is already maxed out, or there's a waiting list, or the waiting list is closed down, you have to keep looking, which is annoying. I do think the Georgia Rental Assistance Program, though, is up and running still, and we're definitely worth a look to help your folks. Yeah, Section 8 is always maxed out. I just saw that little chat pop up. Next slide, please. These are more of the homelessness programs that they have. They have emergency solutions grants and the permanent supportive housing that you can access through the website. As we know, lots of kids and families are homeless. And so these are just more options that you can explore. Let's go to the next one, please. Reentry partnership housing is for folks coming out of the Department of, or coming out of prisons, really. And this is for people who don't have residence plans. So if you're coming back out and you are going to live with your family, this would not apply to you. But if you don't have a plan of place to live, this is supposed to help you. And then the emergency housing voucher is for folks who are either at risk of homelessness or fleeing domestic violence or trafficking, basically, or sexual assault.
I had a question, and that is, do any of these programs help undocumented families?
It depends on the program, I think. I'll be honest with you, this is not my deepest knowledge base, is to the housing. And I hate to sound like an idiot, but I would say go and look. You have to look at the eligibility for each one to see. And I don't know. I would imagine, I don't know. I wish I knew that.
I've seen Sarah Familia and the Latino American Association put out some information on housing and what applies to documented, undocumented. So check there as well for specific information, because I have seen a couple posts of them that are giving out some good education for that.
Yeah, I wish I had thought to look that up when I was working on this. I'm so sorry, but yeah, look at that. And and I will also put that on my list and try and get back to Jill in the next week or so. We'll do a little homework on that and see what we can find, if that's helpful. Okay. All right. And there's I see another question about voices or something.
They just want you to present it in places. I know Virginia, I'll get her,
Okay.
give you her info.
This is my first time doing this particular presentation. So you guys are guinea pigs on this one. So we'll see how it goes. And then you might change your mind at the end. All right, let's go ahead and pop on to the next slide, please. Healthcare. So healthcare is, I looked at resources for you guys and ways to get healthcare. And so you'll see when we get into it, but let's go ahead and pop on to the next one. Of course, for children, the main resource is Medicaid and Peach Care. About over half of our kids in the state are on Medicaid or Peach Care. And so you apply through the gateway system. They are working. Right now, we passed legislation, and I know the Department of Community Health is also working so that when you apply for your child for Medicaid or Peach Care, it will assess whether or not you're eligible for SNAP. They have not gotten that finished yet. They have to get approval from the federal government to do it, but we passed a legislation allowing the state to ask the federal government to do that. So we're very excited about that. That alone will net about, or when kids apply for SNAP, it'll see if they're eligible for Medicaid. It will net about 50,000 more kids in our state, maybe as high as 80,000 more getting health insurance. So we're thrilled, but for right now, these are our options. Georgia Families is sort of the main Medicaid. It's CMO based or care management organization based. So when you apply for Medicaid, you get hooked up, you can choose, or you get hooked up with a care management organization like CareSource or I'm blanking, AmeriGroup. We have 3 at the moment. That's the main sort of broad Georgia Families. Now, Georgia Families 360 is for kids in the foster care system primarily, as well as some kids in the juvenile justice system, and that is all AmeriGroup. Next slide, please. Katie Beckett. This is for kids who qualify as disabled under the Social Security Act and who live at home rather than an institution. Planning for Healthy Babies is for planning for healthy babies. I mean, it's to make sure that we have babies who are not low weight, babies born are not low weight, and it supports families. And then the ASD coverage supports folks under the age of 21.
I had a question from Rebecca. How is EVH accessed? And I think that was pertaining to housing. You would access any of those housing things, you would access through that DCH homepage. Thank you.
Getting on Medicaid provides your coverage, but it doesn't necessarily tell you where to go to get coverage. And if you do not have a primary care doctor to see your child or youth, a lot of folks will go to federally qualified health centers. We have a lot of them in the state, and they are many of them are multi-purpose clinics. So I just wanted to put this up there because if you don't have insurance for your kid, they will help you get enrolled, and they do things on a sliding scale. So we're fans of FQHCs for a lot of reasons because they provide all of these services, many of them. Next slide, please. We also, at Voices, are huge fans of school-based health centers, especially comprehensive school-based health centers. And one way to find those, well, see if your school system has a school-based health center. They're growing. We're getting more every year. And I'll show you a map in a second. But what we love about school-based health centers is that it gets kids where they are, and it helps kids. Oftentimes they help the families. They work on a sliding scale like other clinics. They're self-contained in the school, although most of them are affiliated with the federally qualified health centers that were on the last slide. So they can refer out, and they can refer to the FQHC, the federally qualified health center. And so I can't say enough great stuff about school-based health centers. And if you have an opportunity to get one in your community, or you'd like to see one in your community, talk to your school and ask them to look at the school-based health association and apply, because there are exploratory grants to help schools and communities decide if they want a school-based health center, and if so, how to do it. And those are usually year-long grants, and you don't have to give the grant back if the community decides not to do it. But it's a great, great way to serve not just the kids in the school, but also their siblings and many times their families, as well as the teachers. So we have found that where school-based health centers are, kids spend way, way, way more time. It reduces school absenteeism. It reduces teacher absenteeism, which, as you guys may know, is a significant problem, especially right now. It's kind of like, woo, off the charts. But the school-based health centers are, we just can't say enough good stuff about them. So let's go to the next slide, please. And there are other ones, like CHOA has some. This is just some data on how many centers there are. And it's been growing, like I said, growing like crazy. We've gone from 2 to more than 80 since 2013. That's really saying something. I'll let you absorb that information for a second. Jill, you can advance whenever you think people have absorbed enough. I know it's a lot of information, you guys. I hope I'm not just like so boring. I get really excited about school-based health centers, though, in case you can't tell. It's like one of my favorite things.
Yeah, I know Polly's given the overview, but we'll have all these slides right afterwards. So you can go back and click through the links and exact things.
And this is a map of where they are at the moment, what counties these comprehensive school-based health centers are open. Some school-based health centers are not comprehensive. And by comprehensive, we mean they have, you know, a huge buffet of things. Some of them are less comprehensive and may just do primary care, or may just have primary care plus dental or something. But we're always hoping that they get as comprehensive as possible. And then the next slide is, we can just go to the next slide. This is where there are folks who have planning grants, like the grants I mentioned, and are exploring whether they should do school-based health centers. And let's go to the next, mental health. So at Voices, we spend a lot of time talking about child and youth mental health and behavioral health. And some of that is because our executive director is a licensed clinical child psychologist and is totally awesome. And some of it is because we know it is foundational to child and youth success. Let's go on to the next. There are a lot of ways to get mental health. Usually when we talk about mental health, we think of the payer source is usually how you can figure out where you're going to get mental health services. Like, do you have private insurance? Do you have Medicaid? Do you have any insurance? And there are all of these different options of how it's going to get paid for. And the demand is so high that is part of the conversation, because many providers don't need to take insurance, and you can just walk, like there's so much demand that they can just open their doors and they're full up, they're scheduled up, because we do not have enough providers to meet the demand. So we've had to think about other ways to meet demand for everybody, but especially for families with low income. The community service boards is one way. There are community service boards across the state, and they are overseen by the Department of Behavioral Health and Developmental Disabilities. I think I have a slide next that is a eligibility slide. Yeah, they serve folks with all kinds of things. Some of them serve children and youth. They all claim they serve children and youth, but there are different degrees of that. I'm just going to be honest about it, depending which CSB you have, because they're all individual entities. It's not like the Department of Behavioral Health says we're going to have a CSB here and a CSB here and a CSB here. CSBs run independently, but they are overseen by the department, by DBHDD, the Department of Behavioral Health and Developmental Disabilities. But it is a resource, a good resource. And the CSBs work differently in different areas, but many of them partner with schools. And we'll get to that in just a moment. And here we are. The Georgia Apex program, you know how excited I was about school-based health a second ago. I'm just as excited about Georgia Apex because it is the behavioral health program that is funded by the state of Georgia. They have put millions of dollars into this to develop behavioral health supports within schools. And this is where a community service board, and now I think it's expanding to other community-based providers who aren't technically CSBs, but do the same thing, will partner. Of course, my dog is excited about Apex too. Will partner with the school system to provide intake in the schools. So they will they will work in partnership with the schools and sometimes with public health and DFACs and whatever, if telehealth is involved. But oh my God, I'm so sorry, you guys. But to hang on one second. Gus, come here. Gus, come here. Sorry. And he's barking just to wake you up. But they will partner with the schools to provide behavioral health services, and it's been set in such demand. Oh my gosh, this is so funny. Everybody else's dogs are barking. There's such demand for this, and once school systems learn about this, because of course we do have serious problems with children doing self-harm, with family violence, with suicide issues in schools, that people are clamoring at the doors of Apex to get it in their schools, and I think it's really important. Next slide, please. Project Aware. Project Aware was funded by a federal grant from SAMHSA for a long time, and it's just in these few counties, but it was a very successful program according to the Department of Education. And it was so successful that they are continuing to fund it even after the SAMHSA grant expired or whatever. And I just want to put that up for any of you who are in those counties in Muskogee, Newton, or Griffin-Spalding schools. Next slide. Okay, if you take away nothing else from today, I want you to take away this. The Georgia Crisis and Access Line has been the work because of our challenges with behavioral health services, this has been the one sure way to get in touch with a human being who can give you guidance. Now, I will tell you, it's a crisis and access line. So when you call, if there is a crisis, they do intake. So they will interview you, and it takes a minute to get to see what the crisis is, what the history is, all of that. But they have qualified people on the phone and at the end of the text app who can help you, and they can refer you. And also if there needs to be an intervention, if they have capacity, and we've been working for a couple of years now to build out their capacity, but they can send a crisis intervention team if they need to. And if they have one available, I mean, part of it's making sure that they have one available at the time of crisis. But it's a really great app. I highly recommend it. And I recommend putting that phone number in your phone and sharing it with your
tell other people. So in the full-heartedness of decreasing mental health stigma, I've had to call this for a friend and have someone come out, and they were able to come out and de-escalate the situation and connect them with services. And they're like, how would you even know to call that person? Like, how would you not? It comes across our desk all day long, but tell a friend, tell a family member. It doesn't just have to be people professionally. This is stuff for anyone across the state. And if you're the person who knows, connect someone else.
Right. And I say, get it out there, and give it to kids. Give it to kids because they can, youth can use it as well. And advocate for it. Just saying, we need to keep funding it because it is such a valuable resource. We're big, huge fans, in case you can't tell. Next slide, please. And this is just the stuff it does. So like I said, it's telephone crisis intervention. It helps you find a bed. It links you with urgent appointments and helps you find a state-funded provider in your area for non-emergencies. If it is a non-emergency, sometimes they will say, I will call you back. And they're pretty good about that, has been my experience, because they've got like emergencies that they need to do first. Next slide, please. Childcare and enrichment. All right, so this one is another one that if the pandemic didn't teach us anything, it taught us that people need childcare and to go to work. Like, we all knew that, but there are a lot of folks like the policy, like in the government world, that I don't think quite got their heads around how important that is. So let's pop on to the next slide, please. And one way for families to get childcare subsidies to help pay for childcare is the CAPS program, the Child and Parent Services Program. And it's interesting because if any of you are familiar with CAPS, we know that the go-to, and a lot of lawmakers think that CAPS only serves little kids, like under 5, which is not true. It serves kids up to age 12. In fact, almost probably about half of the kids that CAPS serves are kids who are up to age 12 or up to 17 with special needs. So it's useful for after-school programming and summer programming. You do have to apply, and there is huge demand for this and increasing demand. And lately, the last few years, the state started, it's primarily federally funded, and there's a limit of dollars available. But lately, the state has been putting more money in every year, a little bit more, because they're realizing the importance of it for families, working families of low income. Next slide, please. So the family income must not exceed 50% of the state median income. And that is for new applicants. I do think that folks who are already in the system, I think might be as high as 85%. I went back and forth on the website last night, and I was just too tired to discern the exact thing, but check out the eligibility when you tell people to apply. People do have to do eligible activities for the most part. They waive it. They waive the work requirement or the school requirement for foster parents and grandparents raising grandchildren. The one thing it doesn't cover yet is if you're in school, you can be in a technical college system, going for an associate's degree, whatever, but it doesn't cover four-year university yet. But I do think the agency has that in mind and is planning to do that ultimately. And this is through the Department of Early Care and Learning, by the way. But it covers a lot of other stuff. Next slide, please. Head Start and Early Head Start. I don't know if Allison is on this call or not, but Head Start and Early Head Start are federal programs that there is an office of Head Start and Early Head Start in the Department of Early Care and Learning, but it is primarily a federal program that like the office is in there and it just kind of passes through. But Head Start, we love Head Start and Early Head Start. It offers not just childcare, but also other supports, including nutrition and family services and all of that. And if you have a family that is low income and is looking for help for their itty bitties, as we call them in our house, this is a great place to start. Next slide, please. Georgia's PreK. If you have not heard of Georgia's PreK, then you need to get your hearing aid adjusted because it has been around for, gosh, 20, 25 years. It's been around like a long time. In fact, it's been around so long that when I first started doing policy work, back when the dinosaurs walked through Georgia is when it started, back under Zell Miller. But Georgia PreK is, every 4-year-old is eligible in the state. And the kick is to make sure that you find a lottery funded Georgia's PreK program. They have curriculum, they have social emotional learning. They are very well designed, these programs. And again, they're available to everyone. Sometimes they have to do the schools themselves, the centers, they have private centers and in public schools, just depending on where you live, what you have. But it's extraordinary. And the data outcomes are great for kids who attend Georgia's PreK. We're very pleased. It helps kids be on reading level by 3rd grade, able to read by 3rd grade. So it's all that foundational work that we love. Next slide, please.
I have a question, Polly, and maybe this is on your next slide. For when it comes to COVID money, is there any additional slots or funding for CAPS or PreK or anything like that from COVID money? Because we know there are some gaps in that kind of universalness.
There has been more money as a result, I think, of COVID. A lot of the money was to stabilize the centers themselves. Because part of the challenge is keeping everything open, like keeping places open where kids could go. And at first it was this, I don't know if you guys remember when the pandemic started, because it seems like it's been around for like a century, which, you know, is just awful. But when it first started, centers were closed and people were afraid to go. They were afraid to take their kids. We even had a drop off in kindergarten enroll. A significant number of families kept their kids from going to kindergarten, like a huge number. So keeping the centers open was the first thing. They did expand CAPS and I don't think they bumped anybody off. And I will have to look a little deeper, Jill, to see where we are currently with how that's working. But there were some more monies and the state put more money in as well. But we haven't been able, it's always been a challenge program in terms of demand. Like we just can't meet the demand. And I'm not even sure there's a waiting list because the demand is so high that it's like, how for CAPS. But yeah, it's more of a thing, but CAPS does not play into Georgia's PreK. Georgia's PreK is free. Like it is covered by the Georgia Lottery. And if you can get into it, it serves about 82 to 84,000 kids a year. So that's like 60% of Georgia's 4-year-olds every year, just saying. So it's under that level, you know, you need CAPS for other stuff, but for PreK, you do not. In the summer, you know, we have kids who have other things that the state would like to help them with. And in the last few years, they've started the PreK Summer Transition Program, which is actually 2 different kinds of programs. You have and it's in the summer, it's like 6 weeks long in June and July. And it's only in certain areas, but it is growing. Like the state put more money into it last year. They put more money into it the year before. We're trying to expand it out, but it's for the rising PreK is for kids who are about to go into PreK and whose home language is Spanish. So it is a language-based thing to help kids learn to read. And then the rising kindergarten is for kids who have come out of Georgia's PreK, but still need a little extra help across the finish line to going into kindergarten. And next slide, please.
You know if the decal solve is still going on?
It is actually.
I'll put that link.
It is.
So
I should have put that in there.
age.
Yeah. Yeah, sorry, I should have had that in there. It's hard. And I will tell you guys, there's a lot of stuff moving at the moment. And that's why I said at the beginning, this is not a comprehensive list at all. It's basically like your starter pack to kind of figure out what to do. Now, I will say the other thing in the childcare, there's a lot of work going on in after school programming right now. And the state has a lot of federal funding, COVID federal funding to enhance after school programming and youth enrichment, child enrichment programming. And the boost grants are going out the state right now. And Georgia's statewide after school network is part of division of Voices for Georgia's Children. It's run by Katie Landis and her team, and they are exceptionally awesome and are overseeing a lot of the funding grant that's being granted out, helping do the granting for it's like $85 million is just now starting to get granted out to school systems for after school. And so they're working with the Georgia Department of Education to support the learning. It's not, we call it learning acceleration. I hate to call it learning loss because what the kids learned during COVID, unfortunately, was not necessarily academic, but it was different. There are different kinds of learning going on, but to help kids get back on track.
And I also put a link in there to the after school statewide network, and parents can go on here. You can help them to go find an after school program if they need that additional support to stay at work or other things like that. So this is a great kind of mapping resource as well.
Yeah. And I will say that the statewide after school network is doing their conference this week. Or give their conference. So it's I think things are
represented there too. Yeah.
Yeah. So thank you, Jill. I appreciate that help. And then the child tax credit. So this one is, I'll be perfectly honest, this is probably the most confusing part of COVID stuff, yet it has been one of the most helpful. The child tax credit changes that have come as a result of the pandemic have has raised a lot of families out of poverty and has been hugely supportive. Let's pop on to the next slide. So this is a federal, like income, it's our big federal thing. It's from the American Rescue Plan Act. And it expands a child tax credit. We already had one, it expands it for this year. I don't know what that looks like moving forward, but it has been a huge boon to families. We'll linger on this for a minute and then we can go to the next slide. So it increases the credit up to $300 a month for kids under 6 and $250 for kids between 6 and 17. And it's the thing about it that I think has been most helpful from what I know about it. And I'm not a tax expert. I'll just full disclosure. I'm really probably not an expert of anything, but I'm really not a tax expert. But the ability for people to get this tax credit monthly has been a huge game changer for families because they can plan for childcare. They can plan for their rent. It has helped a lot of families just eke by. And so we're really huge fans. And and I have the wrong title on that slide. I'll fix that before I send it to you, Jill.
No, I can fix it. And I love this because I know even as a professional, a lot of people don't like it when you get paid once monthly. So why would we force people who are experiencing, extremely economic difficulty to have that one annual lump sum versus when they can get it and plan it out in budget? It just doesn't make sense that, we wouldn't want it and we are more able to jump through hoops, maybe in the middle class, than people who are experiencing vulnerabilities.
Right. And it keeps the stress low. And as Jill can speak to this better than I, but keeping the family stress load low is what we're all about. That is what we should think about because when people, here's my soapbox. I'm a great believer that people do want to be their best selves. And when they can't be their best selves and be the best parent they can be, or the best caregiver that they can be, it's often because there's a chink in the armor, right? You're worried about getting kicked out of your house. You're worried about you're being pregnant in a pandemic. You're worried about making sure there's food on the table or socks on the toes. there's this stuff and things like cold hard cash. I mean, just to be perfectly honest, cold hard cash can help fill in those needs that people way up the food chain in government may not even think how important that is.
Yeah, and there's a lot of, I think, stigma or misconceptions that people will misuse money or can't handle, and that's why they're poor in the first place, when really these low income, minimum wage paying jobs, all these other things going on kind of create that climate. And that so many studies have shown that people really are using this cash assistance directly on basic necessities and other things like that. So to be able to give that as a concrete support and primary prevention is really essential during these times.
Right. And kids know, I mean, I also, if you guys, and I don't know all of you who are watching, and I can't even see you. I can just see the little chat bubble, but kids know, right? Kids know and if I had a penny for every time I've heard somebody say children are sponges, they absorb everything around them, I would be rich. But they know when there is something missing. And that's what this, when I was thinking about, when I was working on this PowerPoint, and that's our last slide. As I was working on this PowerPoint, I just kept thinking about what kids know, right? So I know that, when I talk to people in my own family, and even my own family, like my mom grew up really, 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 really poor, and moved. They had to, when they would run out of rent, they would move basement to basement. And it was before the internet, where you could track people down and give them eviction notices that followed them for the rest of their lives, right? But it was, they knew. She talks about how they knew. Like they knew what was going on. They knew when my grandfather was going to come in and beat up my grandmother. They knew, even when they were very small, what was scary and what was dangerous. And some of it had to do with money, and some of it had to do with dysfunction that follows money, and some of it had to do with lack of supports for individuals in the family as well as the family as a whole. So I just hope that you guys could take this information, and like I said, I know it's not complete, but I hope it helps. I hope it helps somebody out there.
Oh, and I think everyone was so great to drop in a lot of additional links that they knew about from their communities to share as well. So I love that you guys are already sharing so much. And I tried to keep a log of that in my browser as I was going as well, so that I can post those along with Polly's slides for those ones that you guys have shared. So Kendra saying the need to have more conversations about needs versus poverty. Some families are teetering on the edge of poverty and don't qualify for services. Absolutely, that really big gap. When we know it takes so much more to have the essentials and necessities than our federal poverty level or others. There's a couple questions, and if you guys have any other, put them in the Q&A for me. So the recording will be available along with the links and slides. So we had one from Bobby a little bit ago that was asking if the school-based health centers, is there a way to find out how far the reach is for those programs, mainly to what extent are services offered outside of parental consent or being informed?
Well, parental consent is a must. And it depends on which school-based program as to how far they're offered. Like some have not, like the newer ones probably are not out in the community, reaching out into the homes as much. But parental consent is something that they have to get before they serve the kids, unless I believe, unless they're in what's it called, in parentis loco, where there's an emergency for a child, like a real life and death kind of thing. But the parental consent is also something that, I don't know how many of you have filled out the tomes of paper to enroll your kids in school, but often there's a parental consent document there. And I do know that when there is not parental consent, when somebody's not signed parental consent, even with parental consent, the provider in the school-based health center will call the parent. They will locate the caregiver, the guardian or parent, before providing a service. And so they're very, I mean, it's a legit clinic. Like you wouldn't just have like a 5-year-old walk into a clinic off the street and not contact the parent, try to contact the parent. And this works the same way. And in fact, also to be clear, a lot of the comprehensive school-based health centers and school-based health centers have their own entrance, speaking of which, to reduce stigma. And also so that when parents have needs, they are not, a lot of parents a lot of families, they themselves have had negative school experiences. And so this is just something else I'll throw out there, is to design a program that takes place in a school, whether it's a literacy program. And well, I could have talked about literacy too, but I only have an hour. Whether it's a literacy program or a health program or a parent education program, think really hard about your audience, because many, many parents did not like school, did not have positive experiences, especially, I will say, low income and parents of color, and adults of color. And so when you set up services and things inside of a school, you have to be very cognizant of the setting. And just because it's a great service doesn't mean somebody wants to go to that building to get it. And so you want to think about, for health, your own entrance, or for different kinds of support or education. Is it a place that just the idea of going back into a school where someone may have had a bad experience is where they want to go?
Yeah, absolutely. Yeah. Our parents don't feel equipped to, I don't know anything about education. Why would I go in there? It might not suit everyone.
Or people are smarter than me. I mean, it's intimidating. I mean, it's even intimidating for me to go to school. And I mean, it is. It's like, there's certain, don't put me in like a chemistry class, because I will have like a nervous breakdown. But there's serious trauma with schools sometimes.
Excellent. So those are really great points. So thank you guys for bringing those up. And for Polly, I also want to point out Prevent Child Abuse Georgia's 1-800-CHILDREN. So this is really designed to help. We have an online map, which is kind of the public facing data we make publicly available. But the key part of that is that parents or caregivers can call in and speak with the resource navigational specialist, can help them understand what's in their area, what they're eligible for, things like that, because many people don't know what to Google, don't know what's out there that would even meet their needs. And it's often a situation, a story, or they just have a lot of going on. So help them kind of point them to a direct direction based on, what they have. So many people it's a story of what's going on rather than knowing exactly what's available that they need. So this is one way they can speak to a resource navigation specialist. And I know a lot of you guys act in that capacity for people you serve as well. And we had one more question in the Q&A. Do you know of a program to help middle school kids with homework? I think that's the $1 million question during COVID.
Yeah, I know it's not at my house. I can tell you that. I think it depends on where they are. I mean, there is, I'm trying to remember the name of it. There's a really great public tutoring program, and oh my gosh, any of you are parents, we used it all the time, and now I'm blanking on the name of it. Because we used it a lot, and there is a resource to call for tutoring where it doesn't cost you anything, and they help you over the phone, or I think you can even go online now. I will look that up though, because what I'll do, and Jill, I don't know if you have time for this or what the turnaround to get this presentation out is, but I'll go through, I just saved the chat a second ago, and I will go through with the links and resources that you guys have put in the chat and add it to this PowerPoint. Since again, this is the first time I've delivered this information all in one place. Yeah, Khan Academy, that's it. Tammy, thank you. Khan Academy is great for middle schoolers with their homework. But I'll add those resources into this PowerPoint so that it's all in one place and send back to you in the next week, if that's okay, Jill.
Yeah, so I'll just post what I have for now. And when Polly sends me the new one, I will update our website with that information as well.
Yeah, and I talked to Erica about putting it on our website too once it's finished, because it's really, if we have one person in our shop who does food access, and we have one person who does family, and so we've had to combine all of that squished into 1 hour, one place. So, and thank you for the PCA thing. I screenshotted that too. I should have had that in there, but I figured you guys already pumped that out.
And this is stuff like we like to refer back to this and keep this live on our website, because you always have people re-entering that are going to be connecting with families. So how can they be of service to help connect them with other things that we know are available? There's so much money that is untapped in the state. Some of it might be because of barriers that are put in place, but some is just how we market it or how we make it accessible for people to find. So being that connector so that we can tap into what is at least there to max that out within our state as well. Yeah, so
I'd love to say one more thing that's just a call out to everybody who's still on and paying attention. The expiration of the housing moratorium is a thing. Please pay attention to your populations and their needs as far as having safe housing, because we know that lack of housing is a driver for mental health and health issues in a huge way, probably number one. And then the number two thing is that with the end of the public health emergency, and I need to look and see when that's ending, we are expecting during the public health emergency for COVID, the like government-y one, the legal one, the state, nobody could push kids or families or anybody who's on Medicaid off Medicaid. So women who are on postpartum Medicaid are still on Medicaid. Like you couldn't dump somebody off. But when the public health emergency ends, people whose eligibility determination has expired are going to roll off. And they'll need to be re-enrolled. And so we want to really, really have our radars up for our populations about kids and those who are on Medicaid and CHIP needing to get re-enrolled so that the next time they go to the doctor, they're ready and covered. So just saying.
That's a really good note. And this is the type of stuff that Voices pushes out all the time on their newsletter. So if you sign up for that, they're always even putting stuff that you can share with families to help them get connected as well. So don't feel like you have to remember this all today. We're going to post it and sign up for their newsletter. That is the best source of what's going on. So we really appreciate your time, Polly, and putting all of this together for us. Thanks. And we'll be in touch soon. So have a great one, everyone. We'll see you back at the 10:40 a.m. is the next session. So we'll see you then.
Thanks. Bye, everybody. Thank you. Thanks, Jill.
Polly, thank you.